847-81 for your health. Join with us now. We've got the folks from the James E. Van Zandt VA Medical Center. We're here with Karch Helsel, who is a clinical pharmacy specialist there. And we've got Sandra Rhodes, who is a nurse practitioner. Welcome to the show, you guys.
Thanks for having us.
Yeah, so you, over at the James E. Van Zandt VA Medical Center, you're hosting a ceremony in awareness for overdose awareness and helping veterans, of course, navigate a time maybe if they're struggling or battling an addiction.
Yes, tomorrow we are recognizing Overdose Awareness Day. It's actually internationally recognized every year on August 31st. It's a time to remember people who've lost their lives due to a drug overdose and remember family that's still grieving the loss of their loved one. Again, it is August 31st internationally, but that falls on Sunday this year. So we were able to get permission to recognize the day tomorrow at the VA.
Why is it important for the VA, at the VA level, to recognize something like this at this level?
Yeah, so I think it's very important. Unfortunately, opioids and other overdoses have had a huge impact on our country. And in fact, in 2023, there was enough overdose deaths in the United States to completely fill every seat in Beaver Stadium, which is the second biggest stadium in the country. Unfortunately, different awareness events and things like that have been able to dramatically decrease the amount of overdose deaths. Last year, there was a 20% decrease in overdose due to different events to raise awareness, so it helps out and saves a lot of lives.
I think nowadays, too, just opening up that conversation and releasing some of that stigma that we hold and associate with overdose. You guys, too, obviously helping people have access to resources, things like Narcan, right, and helping the stigma of carrying that, what that looks like, and giving people the tools to use that if a case would require it.
Yeah, a lot of people think that they're not necessarily at risk because they take it appropriately. But one thing is, especially if you have opioids in the house, you never know if a child or a guest or even a pet would get into it, and of course that can jeopardize the person's life. And so we always kind of compare it to like a fire extinguisher, something that you hope to never need to use, but it's better to have and not use than the opposite. And you never know if you go to the grocery store or walk down the street, and there could be somebody that you could save their life. And there's different laws in place that can prevent, protect you from any legal repercussions for being a good Samaritan and things like that. So
yeah, stepping in and taking action. How would you? I guess it confuses me. How would you know if somebody was unfortunately going through something like that, showing certain symptoms? How would you know when to step in and apply that?
Sure. I mean, if you come across someone who's difficult to arouse or bluish color to their lips, they're not making sense, that would be a fair assumption to try your naloxone. Like Karch said, there is a Good Samaritan Act for Pennsylvania. We are one of the states that participate with that, so you can use it without any repercussions. You're not going to harm the person, but you could in fact save their life.
That's wonderful. And to, just something that you can carry on you on your keychain, right?
Yeah.
You've got one on you right now?
Yeah, there's I have it in my pocket here. This is a sample, but it's very small. It's just a nasal spray that you administer into the nostril, just one spray, and that'll administer the dose. And of course, you would want to call 911 right after to get help. But very easy to carry. I actually have one in my car, just in case I run into somebody, at the grocery store, something that could use, use this medication. So, and the nice thing too, last thing I'll say about that is that even if somebody does have what looks like an overdose, but it's not that, and you administer it, it's not going to harm the patient.
See, that's good. You mentioned that too. I was curious about that. And that's all it takes is one dose of the spray. One
spray, and sometimes you may need more, but hopefully by then the healthcare team, ambulance will be there. You can administer a second dose in case the first one is not enough, but hopefully that should buy you enough time until more help arrives.
Yeah, it's just incredible we have this technology now.
Yeah.
I mean, when minutes matter, it's a crucial time to step in and help somebody. I mean, just as you would do CPR or something else, it's just as simple as that.
Exactly, yeah.
Yes.
Even easier probably than CPR.
Yeah,
so,
yeah, it makes the difference too. And a lot of times we see these are widely accessible or freely accessible too.
Yeah, yeah. So fortunately now they're available over the counter, and you can get them at most pharmacies, you know, all over the place. It still can't, you know, you of course have to pay for it over the counter. So if you're able to get a prescription, you know, that can help reduce some of the financial burdens associated with it. You know, at our facility at the VA, any veteran can come in and they can just ask for a prescription for it, and then they can pick it up at the pharmacy that day if they would like to, as long as we, you know, have some in stock. So it really is great to have this so easily, readily available now.
Just have it on hand. As far as the ceremony, when is that taking place, and is this in, you know, are you inviting everybody? What does that look like? Are you going to be administering things like this or different resources?
Sure, yeah. The ceremony is tomorrow at 1 p.m. at the Altoona VA outside our main campus, Building 32. We're planning a really nice ceremony, and we will have people on hand to give education on overdose, as well as staff that can train and dispense naloxone to folks. So we're really hoping people can join us.
Yeah, come out, take advantage of the resources that are available, and if this is something that's near and dear to your heart, come out and show your support. Yeah.
For sure. Yeah, we've been fortunate enough to grow this event over the last few years, and we actually have had stories where veterans who were dispensed this naloxone at this event have saved lives in our community. So it's pretty great.
That's powerful.
Excited.
Thank you both so much for stopping by and sharing.
Thanks for having us.
Yes. All right.